Hi, my name is Saif I. I'm a first year medical student here with the University of Sunderland. Before we begin, please can I confirm your full name and date of birth? And am I okay to call you Charlie? Hi Charlie, were you made aware you're speaking to a medical student today? And is that something that's still okay? Brilliant. So I've been asked by the GP to test for your cranial nerves. These supply your face and your neck. Is this something you've had tested before? You haven't. Would you like me to briefly describe the test before we begin? That's fine. So in this test, I'll be testing things such as your hearing in each ear, and then I'll also be doing that again with a tuning fork, which is just there. I'll also be inspecting your mouth, the strength of your tongue, and also the strength of your shoulder muscles and the muscles in your face. Is that okay? Brilliant. So firstly, I'm just going to ask if you can just close your eyes and cover one of your ears. I'm going to say a number into the opposite ear at 2 different distances. Is that okay? I'll just need you to repeat the number back to me. So if you can just put your hand over your ear, yep, and then in the opposite ear, 52. That's fine. 76. And then if you can cover up the opposite ear and keep your eyes closed, 66. 7. That's fine, thank you. And now for the next part, I'm just going to use this tuning fork. And what I'm going to do is I'm going to tap it, place it on the bone behind your ear. I'm just going to ask if you can hear it, and when you can no longer hear it, then I'll bring it to the front of your ear and ask if you can hear it again. Is that okay? So again, keeping your eyes closed, I'm just going to tap this. Can you hear that? Yep. Just tell me when it stops. Right, and then can you hear that again? That's fine. And now I'm going to repeat that on the opposite side. Can you hear that? It stopped. And can you hear that? That's fine. So now for the next part, I'm just going to tap the tuning fork and place it at the centre of your head. Let me know if it's louder in one ear or the same in both ears. Same in both ears, that's fine. And the next part of the test, I'm going to ask if you can just stand up and march on the spot, and I'm just going to support you. So for the next part of the test, I'm going to need you to open your mouth and just say ah. That's fine. And normally we'd ask if you could cough, but because of COVID, we won't be asking that today. Are you okay to just swallow some of this water? So if you can just swallow it now, that's fine. So for the next part of the test, I'm going to ask, are you okay to shrug your shoulders? And I'm just going to try to push them down. And are you okay to move your face against my hand? That's fine. So now I'm just going to ask again if you can open your mouth and then stick your tongue out. And are you okay to move your tongue left, right, up and down? That's fine. And now what I'm going to do is place my fingers on your cheeks and ask for you to touch your tongue onto my finger through your cheek. So I'll start on that side. Excellent. And then on that side. Brilliant. Now I'm just going to ask some questions. Have you noticed any heart palpitations or chest pain? Okay, and have you noticed any sort of abnormal bowel movements? That's great. Well, thank you very much for your time. That completes the examination. On examining Charlie, no abnormalities were seen in cranial nerves 8 down to 12. Further examinations could have included a complete cranial nerve examination. Thank you.